Hi, everyone. We'll get started in just a couple of minutes, just waiting for some others to join. Welcome, everyone. Thank you for introducing yourselves. We'll get started here in just a moment. Okay, good afternoon, everyone. I think I'll get started and start with our introduction as everyone is still joining. I am Victoria Ecker, and I'm very excited to see all of you here today to see this presentation of Talk Saves Lives, which is an introduction to suicide prevention. And so if you could put your name in the chat, where you're from, that would be wonderful so we know who is in the room with us today. And I think we'll get started here. Okay, so if you've ever attended an NTAC presentation in the past, you've probably seen this slide a couple of times. This is our disclaimer that this presentation was prepared for NTAC under a cooperative agreement from SAMHSA. All material appearing in this presentation, except that's taken directly from copyrighted resources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors, but citation is appreciated. And also, it's very important that everyone understands that this is not the perception or view of SAMHSA, and that this is strictly from the American Foundation for Suicide Prevention that I'm facilitating for you this afternoon. A little bit about NTAC, the National Training and Technical Assistance Center. This is our multidisciplinary team. We have a large number of partners that come to the table. They have a lot of expertise in various regions and in sources that really help a lot of our communities across the country. A lot of you may recognize many of the names on this slide as well. And with that said, our goal is that all children, youth, young adults, and families with emotional and behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. So all of our partners come together, have various expertise in many different areas, and support the systems across the country. And some examples of our key cross-sector audiences here are state and local agency leaders, the mental health workforce, primary care providers, school workforce, community-based providers, peer supervisors, family partners, and youth partners. And some of our services here are on this slide. And like I said before, it's a robust partnership of many different entities that come together in expert levels here that show no cost training, technical assistance, and resources. And as you can see here, that comes in a variety of different ways. Sometimes it's individual consultation, there's peer learning exchanges, custom coaches, training academies, communities of practice, 5 Things Digest, podcasts, practical tools, and trainings like this one. Okay, so a little bit about myself, Victoria Eckert, and I currently reside in Frewsburg, New York, which is a very small town on the border of Pennsylvania, right in New York. And we're very rural here. I have worked in a system of care community for a little over a decade as a suicide prevention coordinator. I was lucky enough to be trained through the American Foundation for Suicide in this program for you today, Talk Saves Lives. It is an evidence-based curriculum that teaches anybody from any background, any expertise level, any role in the community about suicide prevention. I'm currently the operations director at Youth Move National, part of the NTAC team. Okay, so we'll get started. So as everyone comes in, please feel free to introduce yourself in the chat. If there are any questions, please feel free to put those maybe into the chat. We'll try to answer them throughout. If we don't have time, we'll share my email as well and make sure all of your questions get answered. All right, so just a little bit about Talk Saves Lives. I mentioned before that this is an evidence-based curriculum through the American Foundation for Suicide Prevention. They are the national leading resource entity in the United States for suicide prevention. And they offer a variety of different programs, such as resources for college students, high school students, community members as well. And this is a really great introduction to suicide prevention that only helps us recognize that suicide is a sensitive topic to discuss, but the more we talk about it, the less stigmatized it will be. And at any point during this conversation today that anyone feels they wish to talk more about it, they're feeling maybe emotional about some of the information, please feel free to reach out to me right after the presentation, either through email or in the chat through private message. Okay, so starting with just a very brief overview that, as you can see here, suicide is a health issue. We consider this to be a public health issue that is complicated. I think sometimes we try to understand suicide as something simple as it comes from a life event or possibly a mental illness. And it's complicated. And this presentation today, I think, is nice because it shows the complexity of the issue, how sometimes in life we have these converging things that happen in our life, whether it's life circumstances, whether it's mental health concerns or physical health concerns, that sometimes come together that create an overwhelming experience that someone goes through. And it might be temporary or it could be long-term. What we absolutely know through research, and this is the good news, is that suicide can be prevented. It's not something, despite its complexity, that someone has to live with throughout their life. You know, thoughts of suicide may come and go, but we absolutely can take measures to prevent suicide. Just like there are warning signs and risk factors for other health crises like cardiac arrest. We learn the warning signs and risk factors of suicide that can help us prevent people from dying by suicide. And then, as with other health issues, prevention can start early, far in advance of the problem. Prevention can occur closer to the time of crisis, even up into the act of suicide or after a suicide attempt. And time can be a critical and life-saving measure. Typically, if you think when someone is starting to have thoughts of suicide, if we can put time in between their thoughts, and that helps the risk of suicide subside, and they get through that period of distress, and hopefully can receive mental health support or help. But to prevent suicide, we need to identify persons who may be suicidal, as well as taking an active role in connecting them before they complete an action to take their lives. So I'm going to give a little bit of overview about the scope of the problem, some current research, prevention, and then what you can do. And so I'm just kind of glancing through the chat here. And we have a lot of various expertise levels within the chat, and those are who are here today. And so I always try to, whether you're a clinician, a family member, a young person, maybe a manager in a behavioral health practice, really think about this today as in sort of opening up our mind to maybe some new information. This might be repeat information for you, especially if you're a clinician. But sometimes just hearing it in a different way can maybe spark a new idea, a new way of thinking about this, and hopefully giving you more tools in your toolbox to take care of yourself, but then those that you either work with or are close to. And so what we like to do here is we like to give you some tools to take with you, and to feel confident in practicing asking questions about suicide, and then hopefully getting someone in touch with further supports during a time of crisis. So before we start, through the American Foundation for Suicide Prevention, we like to make sure that we kind of have a baseline of how we talk about suicide matters. Many of us might have grown up with talking about suicide in a certain way, and believing that suicide is only for certain types of people. And so, we believe those things for all sorts of reasons, whether that's something that our family has taught us, whether it is something that media has taught us. And so hopefully this presentation today can kind of lessen some of those misconceptions and give us a better idea of how to go forward, hopefully creating a lesser stigmatized view of suicide. So some language do's and don'ts. We can see here on the left, we want to avoid saying things like committed suicide, a failed or successful attempt. If you think about a failed suicide attempt, right, that is a death by suicide. A failed attempt is that person is still alive, right? And so we don't want to say that's something that they failed on. They're alive. There's more opportunities for connection, mental health support, resources. And then a successful attempt is a death by suicide. So we should say that's what it is. So we want to say things like died by suicide, ended their life, killed themselves, suicide attempt, or death by suicide. And if we're being mindful of the language that we're using, if we're thinking about person first language, we are hopefully decreasing that stigma, saying what it is, and helping people understand that creating a different perception of how society understands mental health and suicide, because when we open up and connect, talk saves lives. So a little bit about the scope of the problem. We know that suicide is a significant issue that affects individuals, communities, families, and it's not in just one community, one pocket of the country, or a particular country. This is a worldwide concern. So a couple statistics to start. Here, we know through research that over 800,000 people die by suicide each year. And this is according to the World Health Organization. And while we have this as the most accurate data available, we estimate these numbers to be much higher for a variety of reasons. Suicide is often underreported in many countries. Even countries that are larger countries is sometimes underreported. And this is for a variety of reasons, whether it's for family privacy, whether it's reporting issues or concerns, or it may not be as clear as you may think. So the 800,000 people globally works out to be about someone dying by suicide every 40 seconds. And in the United States alone, suicide is the 10th leading cause of death. And as you can see here on the slide, in 2019, we had 47,511 people that had died by suicide in that year. And I can say this is an updated version of this PowerPoint. In 2018, it was a little over 48,000. So as you can see, those numbers between 2018 and 2019 are already decreasing by almost 1,000. And we estimate that to be the continued trend for 2020 as well. And this data right here is according to the Centers for Disease Control, the CDC. And we also know that suicide takes more lives in the United States than homicide, war, and natural disasters combined. These high numbers are one of the many reasons that it is important that we talk about suicide, just like any other cause of death. And the more we talk, the less stigmatized the idea that we all face struggle, and we all need support sometimes. So making that a commonality rather than something to be ashamed of or worried of. And then for every suicide that we know of or that's been reported, 25 others attempt. And so that is about 1 million Americans each year that survive a suicide attempt. And so if I look at that, I think to myself that is a lot of opportunity for connection, for resource sharing, for love and support, and recognizing when someone is struggling before it turns into a suicide attempt or a suicide death is so important. And so as we mentioned before, that suicide impacts communities and individuals. When you think about any loss, right, any kind of loss, whether it is a natural loss, maybe sudden, it impacts people in the community no different than that. We look at effects from family, friends, coworkers, neighbors, schools, faith communities, any kind of groups in the community can experience grief from a loss of suicide. It is estimated that the majority of Americans will experience a suicide loss in their lifetime. And I do see in the chat that, some of you have expressed some of your losses and, so very sorry for those experiences. There are a lot of supports out there for suicide loss survivors, which we'll talk about a little bit further into the program as well. So moving on to research. Only in the past several decades have scientists been studying suicide. Research has been shedding light on many critical areas, such as what drives up risk, what amounts to effective suicide prevention research, but we have an awful lot to learn still. So we'll look at a little bit of overview about some key research findings that hopefully help drive the field forward and helping save more lives. So the biggest question is, why do people take their own lives? And as I mentioned before, it's complex, right? It may look like someone is experiencing a very difficult period in their life, whether that's from an event, an experience, maybe mental health related, could be physical pain related. And sometimes we don't know the full picture. So there's no single cause, but rather multiple intersecting factors at certain periods in time. And although we know that there's no single cause, we do know that when these stressors and health issues converge, it can create an experience of hopelessness and despair that causes suicidal thoughts and feelings. Research has consistently shown that the large majority of people who die by suicide have a mental health condition at the time of their death. It may not have been recognized by that person that they were struggling. It may not have been recognized by friend or a family member or a loved one. Maybe it had, but maybe it was hard to get that person support or help. And also, they may have been misdiagnosed, not diagnosed, or adequately treated for whatever they were experiencing. 1 in 4 people will experience a mental health condition, but most do not go on to die by suicide. So I wouldn't want anyone leaving here today thinking that because someone's experiencing a mental health condition, that they would automatically have thoughts of suicide. And that is absolutely untrue. And so it is important that it's clear that we can understand that mental health conditions are not the full story. The vast majority of people who do experience a mental health condition or a health condition do not go on to die by suicide. But we also know through research that there are literal physical differences in the brains of people who die by suicide. They differ from those who die from other causes in both structure and in function. Specifically, we're looking at areas of stress response and impulse control. And so, really thinking about how everyone is different, right? We all have different life experiences, different backgrounds, different ways of coping, different levels of resiliency and taking care of ourselves. And so we may experience the same natural disaster or life event, and we may think that we're similar people, but we absolutely have different perceptions of that. We feel differently, we cope with that different. And so it's really important to understand that sometimes our stress response, depending on who we are, our background, our levels of resiliency, and all of that it might be lower, right? My levels of stress response today may be very short. I just got back from vacation, I'm very tired. So maybe my stress response is a little impaired. Where other days, maybe when I've had good rest and nutrition, exercise, I feel as if maybe I can take on more stress. And so for every person out there, it depends on the day, right? It depends on our levels. It depends on so many things. So really understanding that everyone is different, even from day to day. But it's really important here that all of you leave today understanding that most people who are suicidal are ambivalent about taking their life. So what does that mean, ambivalent? That's part of the person that wants to live and part of that person wants to die and escape that, sort of overwhelming feeling of hopelessness and despair that we talked about a few slides ago. Research has informed key strategies in suicide prevention that engage the part of the person that wants to live. What are those reasons for living? And in turn, helping create distance from those thoughts of hopelessness and helplessness and despair and suicide, and facilitate those thoughts of feelings of living and wanting to live. And so while we connect with reasons for living, at the same time, it decreases the visibility of presence around them of the things that may facilitate their need to die. So one of the many important things that we've learned from research is the perspective of a suicidal person. As you can imagine, this is when the crisis point has been reached, right? They might be desperate. They might feel as if they've let others around them know that they were struggling. They may feel as if they've exhausted every other resource, and maybe they haven't. But this is when that crisis point has been reached, when they have no other answers. That feeling of overwhelming pain and stress has become so intense that they're just desperate to escape that. And I think that sometimes there's a misconception that, when we're struggling with our mental health, our body hurts too. Sometimes we feel as if we have a heavy weight on our shoulders. Our back hurts, our neck hurts, we have headaches, we have gastrointestinal issues. And sometimes it might even be chronic pain, which we'll talk about shortly as well. And during that time of that crisis, our thinking becomes limited. If you think about a time in your life when it was physically a painful experience for you, whatever that was, okay? If someone had asked you directions to your home in that moment, you probably wouldn't have been able to give clear, concise, accurate directions. During that time of intense physical pain, ordinary thinking becomes impossible. And so if you think about a suicidal person who is in the crisis point to escape a life circumstance, pain, their thinking becomes constricted during that time. It's an intense state of tunnel vision where other options just seem unavailable. Someone who considers suicide cannot foresee a time when that unbearable pain could end. And so understanding the perspective of a suicidal person has also helped us understand that suicidal thoughts are often temporary. They can come on intensely and sometimes pass in minutes or hours. So keeping people safe, helping them see reasons for living can be life-saving. So who is at risk? Talk a little bit about what to look for and what to listen for. So risk factors here, I really enjoy this slide because it does show how the three of these categories converge at different points in life. We're looking at health factors, historical factors, and environmental factors. So just like someone who is at risk for something like heart disease because of high blood pressure or a history of heart disease in their family, some people are at a higher risk of suicide than others. And as you can see here, again, that these converge at different points in people's lives and increase a person's risk for suicidal behavior. So looking a little closer, we'll first start with health factors. And the most significant health factors are mental health conditions. And you can see here on the slide, many common mental health factors are listed out for you. Depression is the most common mental health condition and the one that is most associated with suicide. Bipolar disorder is also known to show high risk as well, although that disorder is less common than depression. Because these conditions put a person at a greater risk for suicide, detecting the presence of a mental health condition, whether it is diagnosed, just starting, someone is experiencing signs and symptoms, is critically important. And so the best way to be sure is when someone is saying things that concern you, maybe behaving differently than they typically do, ask questions. Find out what's different in their lives. What are they experiencing? And after you have those conversations, opening up that door to seeking support or help, or maybe a mental health evaluation can be that first step to keeping someone safe. Many people don't realize that their distress may become a mental health condition or a health issue. And just having those conversations can be really helpful in helping someone understand that they might be struggling. Other health factors here are serious or chronic health conditions that can also increase risk, especially when that person also has mental health conditions as well. Chronic pain and serious head injuries have also been found to increase suicide risk. So some historical factors here, the second type of risk factors that we'd like to talk about today. We have a family history of suicide, a family history of mental health conditions or past trauma, such as sexual abuse or combat stress. And research has also found that a history of childhood abuse can also contribute to suicide risk. And while most people who attempt suicide do not go on to die by suicide, previous suicide attempts are also considered historical risk factors for suicide that can also put a person at increased risk. Sometimes you may hear of this as suicide experience. It's sometimes referred to that. So again, understanding someone's background, their family history that you might not be able to see or know firsthand. So if someone is struggling, asking some questions about their past experiences and their family can also give you some insight to what they may be going through or experiencing. And the third type of risk factors are environmental factors. And this involves circumstances in a person's life. And so often there are aspects of a person's environment that can contribute to their overall level of risk. So a couple of the most common is having access to lethal means. And these are different ways that someone may have considered taking their life. And these can be things such as firearms, drugs, bridges, cars. And research has also shown that contagion, which is the exposure to another person's suicide, or graphic or sensationalized suicide accounts, especially those among with other risk factors, can increase someone's risk. Prolonged stress, such as bullying, relationship problems, legal plot problems, unemployment. And then lastly, stressful life events. And these vary across the lifespan. And so, stressful life events for someone in high school or a college student looks very different from someone who's at retirement age. And so understanding what those stressful life events are, the perception of those, and those can be experiences like divorce, legal problems, job loss, other losses. And so to better understand suicide risk, here's an example of a set of risk factors that can converge when someone is suicidal. So this example shows what often is the public perception of suicide. Okay, so we might see someone who is sad, upset. Maybe they've experienced a life event that was difficult for them. And if this person that you see here had died by suicide, we may assume that they took their life because of that stressful event. But that's never the full story. What others don't know is that the person who died may have had genetic risks for suicide. They may have had depression or an anxiety disorder, and perhaps their work life had become increasingly stressful. And maybe they were using substances to cope with some of those stressors. And the key here is that the combination of risk factors could have contributed to the suicide death. Some things we may have seen, understood, recognized, or realized. Some things we just may never have known about. Not because we didn't want to, maybe because it wasn't shared, it was unknown, or the person really hid their struggles well. Therefore, while life event can absolutely play a precipitating role for suicide behavior, without underlying risk factors, life events alone aren't thought to cause suicide directly. So looking forward to the future, research will help us fight ways to fight suicide. Research is looking for biomarkers, for example, something that is testable in a blood sample that would help us identify those at risk. There are a number of clinical treatments, like particular types of therapy, that have shown to be extremely successful and effective for people who are thinking of suicide, but more need to be developed and studied. But the good news is, though, we are learning more and more about what helps someone during a suicidal crisis. And research can also help us to identify the most effective programs and interventions to reduce suicide rates and reduce the risk in those suffering from mental health conditions. So moving on to prevention. And this section is really helpful because I think that this is the section in which you can really take some tools for your toolbox on whether you're supporting yourself, a loved one, or someone that you're working with. So just like there are risk factors that can increase a person's risk for suicide, there are also protective factors. Access to mental health care. When we are feeling connected to family and community support, this can protect someone from suicidal thoughts. When someone is struggling with depression, anxiety, psychosis, substance use, protective factors that may normally be strong can erode and temporarily weaken. It's really important that when we know someone is struggling or we're assuming someone is struggling, having friends and family to remind us of our strengths can be a tremendous protective factor. Also, having problem-solving skills is important. Let's face it, right? Life can be really tough, especially in the last couple of years. So being able to find ways to see ourselves through problems is really important. And when we're not able to do that alone, reach out, ask for help. or if you see someone struggling that may not be able to ask for help, maybe we need to help them anyway. And then cultural and religious beliefs can encourage connecting and help-seeking behavior, discourage suicidal thoughts and behaviors, and create a strong sense of purpose that can also serve as a protective factor as well. And I see a question that just came in the chat is, how do we keep someone safe when mental health medication causes thoughts of suicide? And I think that's a really important question. I actually hear that one quite a bit. And I think always having a safety plan developed with that person is really important. There are a lot of resources out there, especially if you looked up the Suicide Prevention Resource Center. They have tips on creating safety plans. And that really helps us identify with someone that's close to us on maybe what their triggers are, identifying thoughts and feelings, and then breaking it down on how to cope with those, and then who to reach out to when they're feeling unsafe. And if those thoughts, if that medication is creating thoughts of suicide, it's always really important to advocate with either a physician or a psychiatrist or whoever the prescribing provider is on those side effects, right? There's a lot of different medications out there that can be helpful or useful, different levels. And so making sure that we're talking about those with our prescribing providers is really important, because changes can be made. A lot of times medication plans can be flexible. It's also really important when we're talking about medication that causes thoughts of suicide is to always listen to the advice of the prescribing provider and never stop taking the medication without support and guidance from a physician as well. Even if it's uncomfortable, but making sure that we talk to our physician right away if we're experiencing unpleasant side effects. Thanks, Joanne, for sharing that. Mental health care is an important ingredient for preventing suicide. And so getting effective treatment for mental health conditions like depression or anxiety or others can help prevent suicide. Critical to suicide prevention is getting people connected with mental health treatment. One of the biggest challenges, as I'm sure many of you can imagine, in fighting suicide is getting people to address their mental health in the same way as we do our physical health, right? A lot of us go to the gym, exercise, eat right, sleep well, and we talk about that, right? We're very open about that. Everyone's excited about the marathon that they ran, the weights that they're lifting, the yoga classes that they're going to. If we talked more openly about mental health and reaching out and the successes and how helpful that was, imagine the decreased stigma that would give, right? And we also know that anyone who is experiencing a mental health condition, less than half seek treatment, right? Stigma is difficult. Insurance is difficult. Sometimes it's access or transportation issues. And one way to encourage individuals to seek help for their mental health conditions is to treat mental health like any other aspect of our health, right? Got to take care of our body and we got to take care of our brain. And sometimes in someone's life, there could be certain times when a person becomes more ill that they may need help and support to reach out. And it might be critical to seek a trained professional. We need a culture where everyone knows it's smart to take care of our mental health and it's nothing to be ashamed of. So being proactive about mental health, making it a priority. Seeing a doctor, a mental health professional regularly is so important. I know that physicians are now doing screenings, which is just lovely, anxiety, depression, substance use, suicide questions as well. And perhaps getting an evaluation, finding out what's going on, seeking a professional, getting some advice to see, if you're struggling, what the resources are, what the supports look like. And discussing those treatment options, I think obviously, as time goes on, there's a lot of psychotherapy out there, various kinds, short-term, long-term, different medications, different practices that we can do on our own as well. And research has shown that many people, the combination of psychotherapy and medications tend to be the most helpful. But the most important thing is understanding that what is important is finding out what works for the individual. We're not all the same. Some people need longer therapy sessions. Some people need medication. They feel as if they do. Some people don't need either of those and can work through their suicidal thoughts, on their own. It just really depends on the person. But reaching out for a support and evaluation from a mental health provider is a good step to figuring out what you need. The good news is that advocacy efforts are improving to access the mental health services so that many people can get the treatment that they need. The law now requires insurance plans to cover mental health services the same as physical health services. And, if we think about if we need mental health services, and 1 out of 4 of us will at some point in our lives, we should get treated and get our health back on track faster. And the wonderful thing is that is supported just the same as physical health resources as well. And just like people can find strategies to optimize their physical health, like I mentioned before, people can do the same for their mental health, which is self-care. And I know that these are 4 really basic ones on the slide here. And again, self-care looks so different for everybody. Might be exercise, might be sleep, and sleep is different for everyone. Some of us need 6 hours of sleep a night. Some of us might need 10. A healthy diet and stress management here, in my opinion, is probably one of the most important. We want to protect our mental health. We want to promote resilience, but we also want to practice self-care daily. Whether that's lighting a aromatherapy candle, whether it is listening to rock and roll music in your car and singing at the top of your lungs. Maybe it's opening a window and smelling the fresh air. Maybe it is something more intensive like journaling. Maybe it's long meditation sessions or yoga. Finding out what works good for you to help decrease stress and improve thinking is really important. I had mentioned before that there is support for loss survivors and those with lived experience. And that comes in a variety of different ways. And this is also considered prevention. And it supports those who've been touched by suicide in some way. The loss of one person to suicide profoundly impacts many. It's important that survivors have the support that they need, both to heal and reduce their own risk of suicide. And since those with lived experience, which is those who have either attempted suicide or have experienced suicidal thinking, are at increased risk, and we need to make sure they have the support they need too. And so there's a lot of groups that are available, I know virtually and in person across the country, that are led by trained survivors of suicide loss to have peer connection. And so as a suicide loss survivor myself, being trained in that and talking with others really has a profound impact on you. You find out that you're not alone. The experiences that you may have had with your loss of suicide is similar to others. And it really helps connect and heal with others who have experienced something profoundly in their life with sometimes many unanswered questions. And for people who are at a crisis point, the most important thing you can do between a suicidal person and the way of ending their life is time. Research shows that by temporarily reducing a suicide person's access to lethal means, which again are those items that they may have gathered to take their life or circumstances they put in place to attempt to take their life, time for the intense suicidal risk to diminish, time for someone to intervene with possibly mental health support and resources. For the majority of people who experience thoughts of suicide, if unable to access their chosen method, even temporarily, they are unlikely to engage in another action to end their lives. Okay. And I think that's really surprising to a lot of people, that if we had found that someone's plan perhaps is an overdose, and those medications are taken away from the home, or disposed of or locked up, it's not likely they will choose another method. So again, limiting access to means prevents suicide. A clear way to prevent suicide here is just being mindful and asking questions about someone's plan and what their intentions are. And here's a couple examples of some of the things that we might be able to limit access to, or to create a barrier between someone and their chosen method. So as you can see here, there are inexpensive carbon monoxide sensors that could be installed in cars that automatically shut cars off if the carbon monoxide levels reach a certain level. This can save lives. We've also learned through research that installing barriers on bridges deters suicides in many cases. And actually, in many areas where bridge barriers have been installed, they have lowered suicide rates for the entire region. And restricting access to potentially lethal medications reduces suicides. And this can be simple as requiring blister packaging for medication, or those safety taps that make it difficult to get into as well. Firearm safety is a critical conversation in suicide prevention. In the United States, firearms are used in roughly half of all of the suicides, making suicide prevention an important piece of gun safety education. And noted already, and contrary to what you might think, when access to lethal means are limited, most people who are suicidal will not find other means. And so if the suicide death does not occur in that moment, this allows more time for that person to get the proper support and help that they need. So what can you do, right? And I had mentioned before that there are a lot of different experiences that are present here today, different backgrounds, different levels of maybe experience with suicide prevention education. And so I hope that some of this information, if it's repeat, is a good refresher, or really helps frame what anyone can do to prevent suicide. So the first step here, it's important to have a caring, supportive conversation with someone that you might be worried about, to give them time and space to share what they're experiencing. A conversation is a way to show that you care. It allows you to gain more information on that person's life experience, their thoughts, their feelings, their difficulties. And it also helps you get a better idea of their level of stress. And I think a lot of times when I've done this training in person, a lot of the questions that people maybe raise, that they're worried that if they have a conversation and they find out that someone is suicidal, that they're either going to freeze and not know what to do or say, or be responsible or liable somehow. And I always talk about how I would hate to ever walk away from a conversation and feel like I could have done something. I could have asked a question. I could have had a conversation and gave someone time and space to talk about what they're experiencing instead of being afraid. And so I would rather be afraid and sort of be a little gutsy in being able to reach out to someone and let them know that I've noticed differences in them, and then take it from there. So what we want to do is watch for warning signs. And this might be in yourself, this might be in others, might be in people that you work with. And while many of the suicide risk factors we discussed in the beginning endure over a longer period of time, warning signs are observable. These could signal suicide risk currently or in the future. And it's important to pay attention to both the risk factors discussed earlier and the warning signs that we are talking about now. And if you see warning signs, it's so important to reach out and seeking mental health services if you yourself are feeling depressed or anxious, and it's interfering with your daily life, and encourage others to do the same. So this is what we're going to look for here. Suicide warning signs, things that someone says, that they do, their behavior, and then their mood. So we'll go into these a little bit further here. So when someone may be thinking of suicide, we want to listen to the things that they're saying. They may be talking about ending their lives. Now, there is a misconception out there when someone is thinking about suicide, they keep that private and they don't share that with anyone. Now, I want us all just to consider for a moment about how we're all very different people. Some of us are very extroverted, share a lot of information about ourselves with others. Some of us are more introverted and keep things private, maybe are a little bit more quieter, maybe tend to be listeners. And so those concepts apply to how we deal with life, how we deal with difficulties. Okay. So some people may share that they are thinking of suicide. Okay. Some people may not, and may say sort of indirect things that may give us the idea that they could be thinking of suicide. Okay. And we need to listen and be observational and a little intuitive, and to listen to our gut and to hear what people are really saying when they may not have the words to say, I'm thinking about suicide. I need someone to help me. It may be, I can't take it anymore, right? I don't want to feel like this anymore. This pain is killing me. So listen to what those underlying things, those messages might be when someone is speaking about what they're experiencing. Someone may have conversations about how they have no reason to live. So no future talking, really expressing that there's good in their life. They may also feel as if they're a burden to others, feeling trapped and having unbearable pain. And Beth put in the chat that culture impacts what we talk about and how we say about what we're feeling. And that is absolutely true. And that is really important to also take into consideration as someone's culture, their family culture, even where they live. Culture is a huge concept that makes us as people. And so really considering that as well. And behavior. And these are things that we can typically see or observe. And so we're looking at increased use of alcohol or drugs. And if you can think about someone who is experiencing intense psychological or physical pain, sometimes trying to cope with substances masks some of those symptoms, helps us feel better momentarily. But watching for those patterns that are more than usual, that are affecting someone's daily life. Sleep issues, acting recklessly, withdrawing from activities. And, sometimes if we're thinking about young people, they might sort of like withdraw from family and might spend more time with friends. And that is a typical adolescent behavior. But if we're thinking about someone who typically spent a lot of time with their friends and is now all of a sudden withdrawing and staying home, those are the times that we want to ask more questions. Isolating from loved ones, looking for a way to kill themselves, and then giving away possessions. And I also wanted to mention here, possessions, it might not always be things. Of course, it is things that are important, but it also might be making arrangements for pets. It might be creating wills or preparing end of life documentation. And so that might not be, of the character of that person or right timing or things like that. So really keeping sort of our awareness up on those behaviors is really important as well. And then lastly, mood. People at risk for suicide can display, often quite subtly, any of the following moods listed here: depression, apathy, rage, irritability, impulsivity, humiliation, and anxiety. Moods one would expect of someone who is feeling overwhelmed, desperate, in pain. But we all have ups and downs in our mood. It does not necessarily mean that someone is thinking of suicide, okay? But when you notice a change in someone that is uncharacteristically concerning, it's important to talk to that person. Have that courage, have those guts to be able to ask questions. Hey, I noticed lately that you really seem to be irritable and you're not sleeping much. And I know that you're going through a divorce. To talk more with you about that experience and what you're going through. Right? And it's also important to note that unexplained happiness for someone who might be showing a lot of warning signs all of a sudden could indicate that that person has decided on a plan to take their life. They're relieved that they will no longer be in pain. And that may be a warning sign on its own. So being aware that someone who is struggling, who's been going through a lot, is overwhelmed, has been in pain, all of a sudden has a very different mood, is happy, relieved, elated. We need to ask more questions. So trust your gut, right? Assume you're the only one that's going to reach out. Not everyone has been able to take this training. Not everyone has education about suicide prevention. And there's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume you're the only one that is going to reach out. In too many circumstances, people talked about their concern to someone else, right? I've noticed that so-and-so has been struggling. Notice that this has been going on. They don't have the courage to actually speak to that person. So if you're wondering if someone is depressed, feeling anxious, is desperate, is in pain, that's a sure sign you should reach out. If you're wondering, ask those questions. And the same goes for you. If you are having suicidal thoughts, you're not feeling like yourself, you're feeling anxious, depressed, that's a sure sign you need to reach out for help as well. And if you've reached out before and someone hasn't helped you, reach out again. The first time the person may not be receptive, but please keep trying. Talk to someone else, a professional, someone that you're close to, anyone that will listen. And if you've had these conversations with someone and suicide turns out to not be a concern, they may still be in distress. And they may feel comforted and supported just by knowing you care and taking the time to listen. So how to reach out? Talk to someone in private, in a safe space, comfortable. Listen to their story. Give them the time and space to feel as if they can express their pain, tell their story. Sometimes just letting that out is healing on its own. Of course, express concern and caring. Ask directly about suicidal thoughts. And this is probably the hardest one for a lot of people, is coming right out and saying, are you thinking of ending your life? Are you thinking of suicide? Many times as humans, we kind of want to dance around it because we're uncomfortable with saying the word suicide to someone. You will not put that in their mind at all. That is a proven misconception that if we ask someone about suicide, we will not give them that idea. So have that courage to say, are you thinking about suicide? Sometimes when someone is struggling, as much as you've told me, and they've experienced this that you've said, and they're struggling with mental health, sometimes someone thinks of suicide. If that's you, I want to help and support you. And if the answer is yes, or even if you're uncertain, encourage that person to seek mental health services. And if that person is in a crisis, take them to help or call 911. So some things here we want to avoid minimizing their feelings, avoid trying to convince them that life is worth living, and avoid advice trying to fix it. If they're in a crisis, what they need is to be heard and then led to help. Listen to their story, offer them help in finding a healthcare professional, and help them take an active role and steps in keeping their environment safe. And if you think that they might make an attempt soon, we never want to leave someone who has a high suicide risk alone. So stay with them, help them secure or remove any lethal means, and escort them to mental health services. A couple resources here. This is not obviously an exhaustive list of the National Suicide Prevention Lifeline and the crisis text line. There are many, many resources out there. I'm also going to have Joanne share some tip sheets through email for you as well. And of course, like I mentioned before, if you are immediately concerned about someone's safety, always call 911. And we can create a culture that's smart about mental health and suicide prevention by talking about it, talking about our struggles, talking about what helps us, talking about what our self-care is, how we can support one another, having genuine, caring conversations with people, and having the courage to do so, right? You're not going to make it worse. You might be the only one that can ask, that feels comfortable in asking. And talk saves lives, right? So I know we have just a minute here. I just want to flip through these last couple slides here and like to share my email in the chat. I know everyone probably has to leave. So thank you all so much for attending today. We need to hear from you to keep bringing these free resources. There will be a survey that will appear at the end. Please complete that for us. We would very much appreciate that. A big thank you to NTAC, the National Training and Technical Assistance Center today, for allowing me to give you this really important information during National Suicide Prevention Month. As I had mentioned before, NTAC has shared a lot of wonderful resources that are available online for you. So I encourage you to check those out. And if you need anything else, please reach out to me by email. And I think we're at time. Thank you. Great. Thank you all so much. Have a wonderful day.